I was a resident when a visiting professor came in from out of town, and he talked about just doing knee surgery. And I thought, wow, that's really cool. Of all of orthopedics, that's the thing that strikes my interest the most. I see a wide breadth of people, anywhere from young grade school people that injure their knee all the way to adults that start developing knee arthritis. I see meniscus tears in athletes as well as degenerative meniscus tears in adults. I like to make sure that the patients are fully rehabbed, so a lot of my practice pertains to making sure the patients are as strong as they can be to optimize their outcomes, and a lot of times alleviate the need to do surgery. Knee injuries and knee problems are very, very common. A lot of it has to do with genetics. A lot of times there's a family history. Parents that had bad knees, they got sent down to have kids with bad knees and so forth. People are getting more active. At a younger age, the athletes are participating at a higher level. Therefore, they're getting injured more often. So all knee pain has to start at a certain level, and the sooner we can intervene, a lot of times we can alleviate a long period of drawn-out care. A lot of times when symptoms are very mild, we can start physical therapy or other treatment which will make the knee feel much better rather than having the patient wait and get more deconditioned, stiff, and suffer longer when we could have intervened at an earlier level and had a sooner resolution of symptoms. Since we see mostly knee pain, we see patients even with very mild knee pain, so even when they start getting early symptoms, it's never too early to come see us. I'm a big advocate of physical therapy. I try to optimize their therapy. I try to optimize their motion and strength before we talk about surgery, because a lot of times just working on the motion and strength of the muscles that pertain to the knee can be very advantageous and get rid of their symptoms. At Premier Orthopedics, I'm fortunate to have an office that is in the same building as the surgery center, as well as where we keep the patients in-house during hospitalizations, and as well as having physical therapy. It offers the advantage of seeing a patient in the office, they're knowing where their surgery center is going to be, where they're going to be in hospital afterwards, and they can also go down and start setting up physical therapy appointments all in one building. At Premier Orthopedics, we're very fortunate to have a lot of subspecialization, people that specialize just in one body part. And in doing that, I think it provides a much higher quality of care. I'm very fortunate to have a quality caring staff that keeps myself focused and in line. Some of my staff follows me not only in the office but also in surgery with me, and I think that offers a greater quality care for the patient. The staff is the face that the patients see initially. They're the ones that the patients call when there's questions. They're the connection they have on the ground level. Before people communicate with me, they usually communicate with the staff, and having a nice, friendly, educated staff is very important. I'm the medical director and team physician for Wright State, so I see their athletes in all of their varsity and club sports when they become injured. Being involved in the community is very advantageous. I like the role I serve with recreational athletes, with sedentary people, as well as with varsity athletes in college and even professional athletes.